Okay, I don't know if I told any of you what we're doing, but we're on the post show now online. Oh, Margie told you. Okay, good. And I just want to make one quick introduction. We have with us State Rep Brian Spencer, Republican from the Western St. Charles County area.
Eastern Warren, District 63.
District 63, and you've been in the audience tonight, and we wanted to get you in, and especially Ed kind of tipped us off here, so we appreciate it. And first, tell us, you're sponsoring something that plays into this discussion somewhat.
Now, first of all, I mean, I was just sworn in January as a state representative. Before that, I spent 22 years in the classroom, and I usually, because of the style of teacher I am, I usually got this kids that nobody else wanted that would be more apt to use legal and illegal substances to the point of abuse. And so I have that experience as well.
So are you tracking with what we're saying here tonight? Is this what you saw in your experience as a teacher?
Correct. I mean, there was a gentleman that mentioned something about prescription parties that they had. Yeah, those are called Pharm parties, and that's spelled P-H-A-R-M.
Yeah.
As in pharmaceuticals.
No, I admit that I thought everyone was in overalls. Overalls, the first time.
Yeah. Well, I'm from the country, so that's the first thing that I thought of, because the farm party. I'm from the country.
No, unfortunately, much different. But also the bill that Ed was mentioning, you're sponsoring.
Right. This session, it was House Bill 294, which was a Good Samaritan bill, and I've taken a little bit of heat on this because some people think it's a liberal bill. They say that you're trying to sugarcoat drug use, and that's not the case. Basically, it's the argument of conviction versus saving a life. And I just chose to save a life. And really, it's not giving immunity to drug dealers or someone who is a constant user, but it is if someone does get in a situation where we're all at a function together and peer pressure takes over and we get in trouble with whatever drug that we may be putting in our body.
We can call 911.
We could call 911 to save a life. A lot of times you will have a group of friends, and if one is overdosing, they'll drive to the hospital, they'll dump the body off at ER and speed off.
Will we see this reintroduced next session?
Absolutely.
What else did we miss tonight? Anything else? Because that was an excellent part that we did not talk about at all. Anything else that we missed on the show?
I have just a comment. I think part of our culture now is that there's a pill for everything, and we like our pills. And if we don't have coping strategies, then the pill might be the solution. But
we also have infomercials on pills.
Yes.
On losing weight or whatever.
But the interesting thing is that maybe everyone in this studio has taken a pill, but we all respond to it really differently. And in the same way, just take spicy food. Some people love it. Someone else can try spicy food and it hurts their tongue and it's just not a pleasurable experience at all. And you can give 100 patients with legitimate pain a pain pill, and a subpopulation of them will experience euphoria from it. And we can't necessarily predict who those people are, and it can be so damaging for the rest of their life.
Anyone else? What else should we have talked about in that conference room?
Well, I thought you guys did a great job, and so it just seems like there's no incentive for the major players here to change anything. You know, the pharmaceuticals are making money. Our prison systems are making money. 65% of the folks that are in prison have some type of relationship with alcohol and drugs, and so it's left to us to deal with it. It'd be like, how do we deal with this tobacco problem? It was only until the tobacco companies sort of put their feet to the fire that things started to change.
You know, with another thing I mentioned in tweeting while the program was still going, we go to the dentist, we need some pain medicine, so we get 30 Vicodin. How many of those do you take?
Yeah, maybe a few. I don't know.
One, two, usually.
I have excellent teeth. I don't have to do these.
Very nice, very nice. But so we were talking about where the problem comes from, and that's a lot of the problem is that the doctor doesn't want to give you only 4 tablets. You don't want to go to the pharmacy and pay your copay for only 4 tablets.
Right.
So it comes from both sides.
And the doctor doesn't want to be called on a Sunday night when you've run out of your Vicodin and your tooth is still
yes,
aching.
yes,
Right.
Yeah. Yes. Better.
How many of us get upset when we go to a doctor and we're sick, or we think that we're sick and we want to prescription, and we get upset if we leave without a prescription. If they tell us it's a virus and it just has to go away, we kind of get upset because we've paid that copay, we've taken off work. And so our culture says we want a quick fix. And so to your point, where can we do something about it? It starts at home. And so just like we put sunscreen on our kids to go outside, just like we put them in a car seat, we need to talk to them about these things. There was a study released yesterday that said that parents who talk to their kids about drugs and alcohol have kids that are far less likely to use. So let's start talking about it. It begins with pediatricians. It begins in the home.
So, okay, hang on.
I would say it's a society problem, not just parents, but it also needs to be the school. It needs
Absolutely.
to be at church. It needs to be at Boy Scouts, Girl Scouts, whatever. It's a society problem. It's just not a home problem.
Absolutely, but it has to start somewhere.
So just to follow up on your first point, it's so interesting. So now doctors are actually being rated on patient satisfaction.
Right.
And in some cases, not in my community health center, but in some cases, their salary, their bonus depends on how satisfied their patients are. And yeah, if a patient is seeking a pain medicine or a controlled substance and walks away without it, they're going to get 0 out of 5 stars.
That's right. And you walk into a hospital or an emergency room, they say rate your pain on a scale of 1 to 10, and you see a spectrum of smiley faces. And by the end, if you leave with some sort of improvement, then the doctor, the physician seems to have done their job. It's not, is my leg fixed? Is my pain less? And so it's a whole paradigm shift that I feel your frustration in kind of dealing with this, and I know we are seeing it in the community, in schools, in community coalitions as well.
I would like to talk about a little bit that we don't talk about sometimes, and I've been able to participate in a lot of this stuff, is the hope that comes behind somebody that enters into recovery and gets well. And I think what's really important about that part of that piece is that when we talk about it here, from education, prevention, the problems, the people that die, all those things, that's scary. That's really scary stuff. And then when you stop that discussion at treatment, well, nobody really knows what that means. I'd love to talk about folks that are 10 years clean, 20 years clean from this particular chronic brain disorder or disease, and see what the other side of that looks like. As we talk about a stigma where families don't educate, schools don't talk, people don't really want to have this discussion based upon the way they believe in it. That hope perspective changes that. And what I think it does is it pries away some of that fear and allows people to really see what we're talking about. You don't see this associated with anything but mental health and chemical dependency. You don't see this with cancer. You don't really see this with diabetes or asthma. People are not huddled off into a corner and kicked to the end of the herd and said, we'd love to help you, wish we could do something, but we can't. So I think that the hope that goes along with recovery is something that I think would open a lot of folks' eyes to exactly what it is we're talking about.
I have time for one more question that I want to ask, and I just want to see if there's anything else we missed, because we have a lot of change coming January 2014 with Obamacare, as it's mostly known. Anything else that people should know about that?
I think I have to bring it up because this is just really concerning when I read, and we have a gentleman here from the recovery side of things. Right now, our country is already taxed. I mean, our recovery systems, generally speaking, are running as many patients through as they can. We're about to open the floodgates with the Affordable Care Act to the tune of 30 to 50 million people who are going to be added to the insurance rolls. And the numbers of people within that group that have never been able to get treatment because they haven't been insured. I mean, we're talking about millions and millions of people. How are we going to do this?
Jared, you're nodding your head.
Yeah, that along with the parity, hopefully we will be able to treat more people. That's what we want. But as you said, it will be difficult, especially right off the bat. Many doctors, as we mentioned a second ago, aren't trained on this, so general practitioners won't know what to do. But we are seeing from big health centers like BJC, SSM, they're starting to re-engage and start up behavioral health centers. So they can start offering services to these people. They're starting to see this happening. I don't think they're going to realize just how many people will start flooding the gates now that their insurance will pay for it and they're covered with insurance.
And we tossed the word parity around here in this situation, but to be clear, it's equal coverage as it would be for something else that your health insurance coverage.
Yeah.
For mental health coverage, it has to be kind of
Exactly.
equal and greater access.
And just to add on to that, it's certainly better and more cost-effective to manage that in an outpatient setting than in prison, which may occur more now.
Yeah.
Yeah,
Okay.
right now, the largest provider of treatment in the U.S. is the penal system. And this is costing us, as you just said, a lot of money. It is so much cheaper if we have them go to a doctor, go to an outpatient treatment facility instead.